Hi, my name is Tserotas, and we're going to be talking today about nasogastric tube insertion. So first, you always want to verify your order for an NG tube. And so a lot of people will get an NG tube placed possibly because they have a small bowel obstruction. And so your patient needs one because of a small bowel obstruction. And you want to make sure that your assessment is in line with that small bowel obstruction and that makes sense for you to actually place the NG tube. Once you've done that and you've verified your order, you're going to go gather your supplies. And so you're going to need to bring in your stethoscope. You want to bring in a Chuck's pad, or you could bring in an Edmonds basin. That's fine. You want to bring in your NG tube. This is what it looks like. And then you want it's going to say gastric sump tube. It could be Salem sump tube. Those are just different kinds. And I'll say gastric sump. And then you see here it's a 12 French. So that's the size, and you'll need to document that as well. Okay, so you've got your NG tube. Then you'll need a large syringe. And you'll see here, this is a 60 cc syringe. It has a cap, no needle, and that's what it should look like. Then we need to bring in some good strong tape. You'll need your pen light. You'll need a tongue depressor. You'll need a packet of lubricating jelly, probably KY jelly, there for your tube. You will need a safety pin and a graduated cylinder. You'll also want to bring in a cup with a straw. And then for our mannequin, I'm actually going to use this spray lubricant instead of that. Okay, and safety pin as well. Alright, so I've gathered all my supplies. I've come in my patient's room. Hi, Mr. Kelly. My name is Shopa. I'm going to be your nurse today. If you could just verify your name and date of birth for me. Great. And how about any allergies? No? Okay, good. Well, I know that you came in and the x-ray showed that you have a blockage in your stomach. And so the doctor wanted to put an NG tube down into your stomach to pump out all the stomach contents so you'll feel a lot better. Okay, this procedure is not particularly painful, but it can be uncomfortable, but I'll try to go through it as quickly as I can, and I'm going to help you kind of coach you through it and let you know what you need to be doing while I insert the tube. The tube does go into your nose, into the back of your throat, and then goes down into your stomach. Okay, so Mr. Kelly, you know, he doesn't really want to do it, but of course he said he agrees to it and he's fine. And so I want to make sure that my assessment makes sense to place this NG tube. So I'm going to put on my stethoscope, and I'm going to auscultate bowel sounds in each quadrant. I'm going to palpate his abdomen, and it seems firm and it's rounded and it's distended, and he does have hypoactive bowel sounds. Are you nauseated at all, Mr. Kelly? You are pretty nauseated. Okay, and again, this procedure will help get those contents out so you're not as nauseated. Okay, all right, so I've got my stethoscope there, I've got my supplies. I'm going to do some hand hygiene. I'm going to get some gloves. Now, some equipment that you'll need besides what I just showed you, you'll need to make sure that you've got a canister like this one set up with suctioning tubing set up to your suction vac here, and then you want another suction tubing here that you're going to connect to the NG tube once you have verified placement by an x-ray. Okay, so we'll get that ready. Make sure you have all of that set up. Now, monitoring outtake and output here is extremely important with this canister, and you'll see there's measurements here, and so you'll want to document the output, color and consistency of that output, and especially you're going to monitor that very closely once you initially put the NG tube in, and also of course every shift. Okay, and this you want to turn to regulate and turn this up, and normally, let's see, I'm going to put it to regulate, turn it up, and then the needle should go up between 80 and about 100. Okay, and you'll hear that suction come on. Okay, so to make it easier on my back, I'm gonna put this rail down. Okay, I've got my supplies ready. I'm going to get a cup of water ready. And a lot of times it's nice to have an assistant that'll kind of help if your patient's unable. But I'm going to have Mr. Kelly hold his own cup, and I will instruct you when I want you to start drinking that water. Okay? All right. So let's open up our NG tube. We're going to put our Chuck's pad out. You could have an emesis basin ready if you'd like. Put that out there. Open up my syringe. Get that ready. Have my pen light handy. Open up my tongue depressor here. Get that ready as well. Now this technique is not sterile, okay, since you'll be going through the nose and down the esophagus. So we'll have this ready. But of course you want it to be as clean technique as possible. I'll have my safety pin ready. And now I'm going to get 3 pieces of tape ready. And you can do this without your gloves if you want. But I want a little piece of tape. And that's to mark off my measurement. Then I have a long piece of tape to secure this to the gown. Then I have kind of a medium piece of tape, and I'm gonna fenestrate or split that side so that can be connected to the nose. And there's also specific NG tube sticks that you can put right here on the nose itself, and there's a little hook. So if you don't have that in the hospital, you would use this method instead. Okay, so I'm going to get my NG tube out, and now in order for me to safely put this NG tube down, I need to measure. So I'm going to go from the nose to the earlobe. I'm going to palpate down to the xiphoid process. Okay, and I'm going to, if you see here, there's usually measurements on these. I'm going to put a piece of tape right there to note my measurement. For some reason this one doesn't have numbers on it, but usually these little stripes are called radiopaque stripes, and they're able to be picked up on x-rays very easily, just as well as that white stripe. So once we're all done, we'll confirm placement with an actual x-ray. But normally you would have measurements on here and numbers, and so you would document that number. Okay, and so at this point I'm going to lubricate. Normally you would open your packet, you'd put it on here, and you'd lubricate that way. But since it's a mannequin, I gotta use this spray. Okay. All right, so I'm gonna talk to Mr. Kelly. Have you had any facial reconstruction surgery or any sinus surgeries? No? Okay, great. If he did have major facial surgery done previously or any major sinus issues, then the doctor may order like a CT of the head to see, you know, if it's safe to put that in. And usually the physician will, if there's any special cases, may actually place the NG tube himself. And so he said no, he doesn't have any of those special issues. Then I'm going to see which snare is most patent. Can you breathe in each side for me? Okay, either one's fine with you? Okay, great. So I'm just going to go in on the right side and get your cup of water ready, okay? And then I'll tell you when you need to swallow. So put his head up slightly at the beginning and just go upward. Now have him hit his chin to his chest and turn the tube slightly and feed it in. And then I want you to look in the back of the throat with your pen light and your tongue depressor. So you're going to open up the mouth and you're going to turn the light on. Let's see if we can turn this light on. Well, can't see real well with that light, but normally you take your tongue depressor, and if you can see back that white stripe, it's straight in the back of the throat, and that's what you're looking for. Okay, so that's great. Now we're going to continue to feed that downward till we hit our marking. If the patient's coughing or appears to be choking or out of breath, then you need to stop and you need to pull the tube out. But he did great. We've got it right up to the measurement, and now I'm going to secure that with my split tape. And this doesn't stick real well on Mr. Kelly, unfortunately, but you can do a skin protectant prep at the hospital to help this stick better to the skin, and you're just going to wing that around here. Okay, now we've got that secured. Now I want to show you two methods in order to check for placement at the bedside. So one other thing that you would want to bring with you is called a pH card. I don't have one here with me, but some facilities require that you check by pH and by auscultation. And so you would just have your pH card out here, and you would get your 60 cc syringe. You would keep this connector, you'll always need that connector, and hook it up to your blue part here, which is normally just like a vent system. You're going to keep it like that. Then you're going to aspirate back some gastric contents, and you're going to note the color of those gastric contents. Okay, once I've got that, I'm going to hook it back up. I'm going to put it on my pH card, and your pH card is hopefully going to show you a pH of less than 6, usually between 4 to 6. If your patient's on a proton pump inhibitor, it could raise it up a little bit between 5 and 6. So this is just one method to make sure we are in the right place. A second method is to do this by auscultation, and we're going to get our stethoscope. Remove the gown, and I'm going to listen in the gastric region. And I'm going to draw up about 30 cc's of air on the abdomen, and I'm going to, as I push the syringe, I should hear a distinct gurgling or whooshing sound. If you're confusing it with bowel sounds, as soon as you stop pushing on the syringe, the sound should stop. And as you continue again, the sound should resume. Okay, so if I hear those sounds as I'm pushing the air, then I am positive for auscultation for placement. And it sounds great for Mr. Kelly. Okay. Alright, so we have checked 2 ways and looks really good. We're going to clamp this. This is called clamping your NG tube. Now we're going to connect right here. And we're going to pin this to his gown. Being very careful, of course. Okay. And now at this point, before I hook it up to suction or before I do anything else, I am going to make sure that I verify placement by an abdominal x-ray. Okay, so I would call radiology and get an x-ray and make sure that that's all, that it's in the right place. So let's say I've sent Mr. Kelly to an x-ray and now he's come back, we've confirmed placement. I'm going to hook his NG tube back up to suction. And so you're going to use this connector right here, so don't ever throw that connector away. You're going to hook this up to the suction, and it should stay in there